Hello, I'm Jenifer Lightdale. I'm an associate editor on gastrointestinal endoscopy, and it's a pleasure to be here with Dr. Chiu
very nice
from
to
Taiwan.
meet you. Yeah, thank you.
And Dr. Chiu is going to be discussing a paper that he was one of 14 authors on, entitled Knowledge, Attitudes, and Barriers of Uptake of Colorectal Cancer Screening in Asia Pacific, a multi-center study. And it is a very impressive multi-center study. So.
Yeah, thank you very much for the invitation. And I'm here on behalf of our working group and all of our other co-investigators of this study.
That's great. That's great. We're really pleased you could get here to do this. So, obviously the big question is, why did this group come together, form, and what's the rationale for going forth with the study as you planned it?
Yeah.
Can you tell me also what exactly is the name of the group, just so we all learn?
Asian Pacific Working Group on Colorectal Cancer. Now, actually, the working group leader is Professor Joseph Song of Hong Kong, and he called for action in 2004 because in the past few decades, the colorectal cancer incidence increases 2 to 4-fold in this region. So he invited National Endoscopy Society key opinion leader, and we organized this working group to do some useful studies and some epidemiological studies that can facilitate the colorectal cancer screening in this region. And we also formulated a consensus statement on colorectal cancer screening. And in the future, we would like to develop a useful practical guideline that suits the need of Asian countries.
Fantastic, fantastic. So the actual aim of the study that now has been published was exactly to what?
Yeah, and the rationale of this study is actually because the remarkably increased incidence of colorectal cancer and such a big change in epidemiology is considered to be caused by westernized lifestyle and that habit. But before we can change the habit or lifestyle of the people, we think that screening is the most efficient way to detect colorectal cancer at earlier stage and also in precancerous stage, such that we can reduce the mortality and even incidence of colorectal cancer.
Okay, so you were looking to understand knowledge, attitudes, beliefs across the entire region towards screening.
But unfortunately, we do not know the main barrier, attitude, and the knowledge of colorectal cancer of the people in this region. And even in some countries that already have nationwide screening program, such as Japan or Taiwan, the participation rate or uptake of screening tests remains far from ideal.
Is the theory that it is the people coming to the doctors or the doctors themselves that are the barrier?
Yeah, our finding the major finding was that the doctor is the major determinant of the uptake of screening tests.
So, and going into the study, you hadn't realized that that was really a big
because
piece of
we
it?
have reviewed some Western and the Asian studies previously published, and our finding is quite inconsistent with previous findings. Yeah.
Well, the study, of course, was remarkably multinational and actually had 14 participating countries spread all across Asia Pacific, including the Philippines, Australia, obviously Taiwan, and then India, Pakistan. And so, I mean, it's just incredible. How did you conduct this study? And it's well done, so congratulations.
Yeah, thank you. Yeah, before this study, we have already done some epidemiological or clinical studies under the framework of this working group. So it's not so difficult for us to organize and assemble together to do a new study.
And nice. So you actually had the infrastructure in place and you said, okay, now we're going to look at another question. Yeah. And of course you had this unbelievably high survey response rate of greater than 90%. Yeah. So is there anything you felt really helped you achieve this? Or?
Yeah, I'm not aware how can we achieve such a high response rate?
Yeah, it's impressive.
But we cannot have it without the help of our co-investigator and their excellent assistant.
So I mean, it really shows dedication of the team to try to answer the question. So, so in terms of the fact that this, the implications of the analysis really were that physician recommendations to patients was probably the most important factor. Where are you going now with this finding?
Yeah, according to our previous consensus statement, we recommend fecal occult blood tests and flexible sigmoidoscopy or colonoscopy as the screening tool in Asia-Pacific region. But FOBT should be the first choice for country or region with resource constraint. And we now already developed some risk score, Asia-Pacific risk score, and now we are going to test this risk score system in population setting. And we included age, gender, smoking habit, or family history of first-degree relative, and very simple scoring system. So in the future, we would like to compare this scoring system with the most simple screening test and whether it really works in the population setting.
Well, it sounds terrific, and it really seems like you'll be able to move the dial a bit.
Yeah.
So congratulations again.
Yeah.
Thank you.
Thank you.
Thank you.